Parti Gerakan Rakyat Malaysia calls upon the government that in our haste to reach a target of 1:400 doctors population ratio, and in some of these OECD countries, Malaysia has a commendable ratio of 1 doctors to 1,100 as beginning of 2009. I mean, we are not far from 1 doctors to 400 patients. So we should not, because in the haste to achieve this target, I think we should not compromise on the quality of doctors that is being produced. In the haste of achieving the target of 1 doctors to 400 patients ratio, I think we should not compromise our doctors, the quality of the doctors that is going to be produced. Secondly, Parti Gerakan also strongly urges the government to temporarily stop issuing new licenses for medical schools until such time that the country, the ministry or the government is assured of the availability of training facilities and necessary infrastructure, so that the standard of our medical graduate is not compromised. Parti Gerakan also urges the government to find ways to ensure a high standard of doctors being produced and seek ways to alleviate the problems of too many house officers being posted in some of our hospitals. So in order to produce good quality medical graduates, Parti Gerakan also calls upon the government to ensure that the entry requirements of the students into these medical schools, the newly established medical schools, meet the required standards. The sudden increase in the medical schools, in the number of the medical schools being 21 in the last 10 years, may result in the fierce competition to enroll students, and this is a real danger that some of the medical schools may lower their admission requirement. Last but not the least, Parti Gerakan urges the government to spare no effort to ensure continued public confidence in our healthcare system by ensuring the standard of all our health personnel, and not just by building grandiose 5-star hospitals without considering the aspect of starving these hospitals with competent and well-trained medical personnel.
We are only against doctors who may not be adequately trained. You see, once they pass the housemanship stage, they are given the license to practice, and this license is actually like a license to cure, and it can also be a license to kill department heads who is working in government hospitals. Some of these doctors have told me that it is almost impossible for them to supervise and adequately teach 60 housemen in the unit. Because as consultant, they need to attend to patients, they need to make ward rounds, and you see, if there are so many doctors following him in a ward round, he can't really supervise the training and the teaching. So this is a problem, that when you have too many housemen in one unit,